Well, Doc, we know that many men are involving with premature ejaculation, so please explain what is it and how do I know if I have it? Okay, let's talk about it. Premature ejaculation, or PE, is when ejaculation happens sooner than you'd like during sexual activity, and it causes distress or frustration. The most commonly used medical measure is the intravaginal ejaculation latency time, basically the time from vaginal penetration to ejaculation. Studies show the average time for men in the general population is around 5 minutes. In clinical terms, ejaculation consistently happening in under about 1 minute or marked reduction to around 3 minutes or less, combined with inability to delay it and negative impact on you or your relationship, is considered premature ejaculation according to the guidelines. Okay, why does premature ejaculation happen? What is the cause? Look, there is no single cause. It's often multifactorial. Theories include abnormal serotonin signaling in the brain, heightened penile sensitivity, anxiety, performance pressure, or even genetic factors. Sometimes prostate issues or thyroid problems play a role, but in many cases, it's a mix of physical and psychological elements. The good news, most men can improve it significantly with the right approaches. Right, let's talk about the solutions, how I can last longer. One of the easiest and most effective starting points is using condoms. They create a barrier that reduces direct stimulation to the penis, lowering sensitivity. It's simple, no prescription needed, and also protects against STIs and pregnancy. I've heard about start-stop technique. How I can do that? Does it really work? Yes, absolutely. During intercourse, when you feel you're getting close to ejaculating, stop all movements for 10 to 30 seconds until the urge passes. Then start again. Aim to repeat these 2 to 4 times before allowing ejaculation. Talk to your partner first so they're on board. It makes it much more effective and less awkward. The squeeze technique is similar. When you close, you or your partner gently squeeze the head of the penis for a few seconds to reduce arousal. With consistent practice, most men gain better control over time. And what about the numbing products? Do they really work and are they safe? Topical anesthetics like lidocaine creams or sprays can be very helpful. They reduce sensitivity on the penis, delaying the signals that trigger ejaculation. Apply them 10 to 20 minutes before sex, then wipe off excess before penetration so your partner doesn't lose sensation too. Start with a small amount to avoid overnumbing. They are available over the counter in many places and work well for lots of guys. This question may seem a bit weird. Do sexual positions make a difference? Yes, position choice can help a lot. The underside of the penis has a high concentration of sensory nerves, so positions with less direct friction there tend to help you last longer. Okay, what about pelvic floor exercises? Definitely, strengthening your pelvic floor muscles, the ones you use to stop urine mid-flow, gives better control over ejaculation. Evidence show pelvic floor training can significantly increase time to ejaculation, especially in lifelong cases. You can do Kegels at home. Contract the muscles for 10 seconds, relax, repeat 10 times, 3 sets a day. Let's now talk about medical treatments. Do pills really help? Yes, certain medications are effective. SSRIs, or selective serotonin reuptake inhibitors, a type of antidepressants, delay ejaculation as a side effect by increasing serotonin levels. We'll cover medications in more detail in an upcoming video. There are several invasive options. Can you talk about them? Some more invasive treatments exist, like circumcision or hyaluronic acid fillers, to create a barrier and decrease sensitivity. These are not first-line options, carry risk, and are usually considered only when other treatments fail. The key is starting with simple things like condoms, behavioral techniques, and pelvic floor exercises. Most men see real improvements.